Houston, and today I'll be discussing my change project proposal. Of original authorship. I certify that I am the sole author of this assignment. Any information in this assignment that is not my own is clearly documented. I use quotation marks appropriately. I cited any and all sources from which I use data, images, ideas, or words, either quoted directly or paraphrased using the APA 7th edition standards. I also certify that the information in this paper was prepared by me specifically for the purpose of this assignment, and I have not submitted any parts of this assignment for previous assignments. I understand that plagiarism policy of Athens state and nothing in this assignment violates intellectual property laws. My typed name below is intended to be the same as my signature on this document. Emily Houston, June 17th, 2024, Nursing 440, Leadership and Practice. Find the issue. The issue I have selected in this project is medication errors. An example would be medication should be checked more frequently and more often for accuracy to prevent harm to patients. Discussing efficiency, effectiveness, and financial savings of improving the selected clinical issue of medication errors would be improving efficiency can cause preventing more errors from occurring. Nurses can be more effective by using the 5 medication rights, which are the right patient, the right drug, the right time, the right dose, and the right route. And lastly, financial savings for the hospital by reducing medication errors can save the hospital money. Some ethical, policy, or legal concerns with medication errors would be harm to the patient, erosion of trust, quality of care, and potential lawsuit. To the right of the PowerPoint, I did a stakeholder analysis of medication errors. In the middle, I have medication error, and who's affected is the patient, the provider, the nurse, and pharmacy. My collaborative team members for this assignment, I chose Dreama Hill. She has her bachelor's of science of nursing, and a clinical pharmacist, Dr. Lee Vasco. Discussing power, influence, and impact. Power has a lot to do to influence, and they're used to get others to take action. Power is based on positive authority, while influence is based on relationships. Both of these can have a positive or negative impact on the patient while giving medication and producing either a positive or negative impact. Issue of medication errors for my cause and effect diagram. An example I use for the adverse drug event that all could lead to causing it is drug administration errors, ordering errors, pharmacological factors, psychologic factors, and patient errors that can all lead to adverse drug event and cause harm to the patient. For the planning, I've decided, along with collaborating with Dreama Hill BSN and the clinical pharmacist Lee Vasco, that we would do a new process to prevent medication errors. The medication errors will be improved by pharmacy and we'll have to make the order active prior to getting the medication out of the Omnicell we use here at the clinic. Evidence-based literature I used was barcode medication administration, which means we need to scan the patient's wristband and medication prior to administrating it, and that was received from the National Library of Medicine. This is a supportive process in hospitals they use to prevent medication errors. At the clinic I work at, we do not have patients that wear wristbands because we are an outpatient clinic. We pull medications from an Omnicell and scan them and then label them. Another evidence-based literature I also used from the National Library of Medicine was technology utilization to prevent medication administration error, was computerized physician order, which means we need to use technology more versus a handwritten piece of paper to have a physician order on the computer that is active prior to getting the medication out of the Omnicell. The main goal of my desired change of preventing medication error is a two-step check process prior to the nurse being able to get the medication out of the Omnicell. By first the provider putting the medication order in on the computer, and then it's pending for pharmacy to review, and once pharmacy reviews it, then the medication becomes active. My SMART objective for my desired medication reduction is 6 months. All nurses will have an active order and 0 medication errors from the Omnicell. By pharmacy will track it by pulling records online using a computerized process to where they can show which nurse pulled what medication and if there was an active order prior to the medication being pulled from the Omnicell. Here is my force field analysis. In the middle, of course, is the medication errors. My driving forces is patient safety, nursing license, and reduction in hospital stay. The restraining forces I can be pushing against this is time, staffing, and wrong orders being placed. All these go hand in hand in medication errors. I will deal with the resistance by communicating with the staff and my coworkers the benefits, the positive benefits of the change that we are implementing. I will elaborate on the change and how it will positively impact our patients and cause reduction in errors, which can have effect on our licensure. And I will allow feedback and improvements processes from staff members. Strategies to motivate others to adopt the change would be, I would discuss how positive the change will be and how it will greatly affect all of us nurses and providers and the patient, and that the patient is the #1 reason why we're here, to take care of them, and we don't want to cause any harm. 0 harm is our policy. I will be open and empathetic with my team members and staff, and I'll listen to what they have to say. I will offer teach and learns so that each person will know how to check and make sure that the medication says active prior for them going into the medication room and pulling the medication. The change process theory I chose was Lewin's change theory on page 35 of Leadership in Nursing Care Management. The process Lewin's change theory uses is unfreezing, moving, and refreezing. So unfreezing, the nursing process would be assessing, and the problem identification would be, we'd be identifying the medication errors and how many are occurring. For moving, it would be planning and implementing. I'd be planning on a change in how we're going to implement it in the clinic, so 0 medication errors would obtain on the patient. And then for refreezing evaluation, after implementing the process and giving the 6-month evaluation, I would go back and see what worked and what didn't work, and possibly I would review the evaluation and go from there and see what changes can be made to the process. And review. Now I'm going to discuss how to influence those around me to adopt the change, including the innovators, early adapters, early majority, late majority, and laggards. With all of this in mind, I will encourage people around me and show them statistics about why we want to adopt this change and the process for the change and how it will affect everyone. I will encourage everyone to do their own research and implement the practice of adopting the change to show them how greatly positively it will impact us all. I will monitor the progress, and how I will measure success would be I would get pharmacy to pull reports to check for accuracy, again stating that I would check for the nurse, the medication, and make sure there was an active order prior to it being pulled. Service benefits listed in this was quantity, making sure that the number of nurses pulling the medication had an active order, and that the number of patients receiving the medication, that there was an active order to keep them safe. My reflection and summary on this entire change process: I think it was very interesting. From researching a topic I was very passionate about, medication errors, and to doing more research on how to improve reducing errors. We actually, at my facility, do use this process, so it's not 100% new process. It was implemented last year, and I think it's a great process, and I would consider it for most facilities to adopt this process, because I think it's very important to reduce medication errors. I think it caused to have more critical thinking, which is good, and it made me really think about nursing staff and our supervisors and what they go through when they want to implement changes within the clinic. The time to listen to my change proposal. Here is a reference of all the articles, the book I used, and my scholarly resources. And I hope you enjoyed this presentation. Thank you.